course, we know many of these women from the onset have what we call anemia. Their blood level is already low. And anemia, there are many causes of anemia, even malnutrition. That's why I said management of maternal mortality goes beyond the health sector. Who is responsible for dealing with the nutrition of the individuals? The community, you know, and then stakeholders, various stakeholders. So the people, the pregnant women need to eat well. They need to be properly nourished. There are food taboos that prevent the pregnant women from eating nutritious food. So they don't eat some of those proteinous materials that they need because because of the culture. So we all need to contribute in day and night. Sometimes the community, somebody tells them, oh, it's too early before they get there. We've had issues of also people entering traffic, having to look for a taxi, struggle to get a taxi to get to a health facility. Women have lost their lives that way. So that's where the community ambulances come in now, because you can have an ambulance pick the woman up and then they can blow the siren and open the road. So those delays also contribute. But another phenomenon is preeclampsia. Pregnancy-induced hypertension has been found to be a leading cause of these mortalities. Certain women develop hypertension during pregnancy, and it needs to be detected early and be dealt with on time. And they need to be regular on their medications, and they need to have highly supervised delivery. But preeclampsia, pregnancy-induced hypertension has been found, or eclampsia, they become eclamptic. When they develop eclampsia, some of them develop renal failure, some of them develop convulsions, and it tends to kill quite a number of people. So the communities need to all contribute and ensure that the women, so I think it's our collective responsibility to ask women, have you gone to NOS? Have you gone to ANC? When was the last time? You know, we also need to support them. And sometimes the medications given to them, some women say they make them vomit. They give them funny tests. They don't drink them, and we don't know. So, and also blood donation. People need to donate blood. We have seen a woman who...
Honorable Minister, let me remind you,
yes, sir.
2 minutes.
Okay,
response
sir.
To...
I will just say this one. A woman passed away, even, you know, because of bleeding. Even the husband refused to donate blood because the husband's mother said if he donated blood, he was going to be weak. So the husband didn't donate, and the woman died. You know, so we have serious issues like that. So it's a community thing, and the TABA issue keeps on coming. TABA is a big problem. It's a big problem, Honorable Speaker. Even young ladies are using it now, and it causes friction. It causes bonds in that place, and then you know it can cause tears during delivery. It can cause you know it can cause infections. You know, and then because there are strictures in that place, so when the baby wants to come, it could tear the place, and then they end up bleeding. So TABA, we need to all advocate against this TABA. It's causing a big problem for us. Yeah. Thank you very much.
May I observe, Honorable Speaker? Honorable Speaker,
yes,
Member Followasan.
Who is speaking?
Member Followasan. Can you, Honorable Minister, can you kindly differentiate what this TABA is? Is it the one that they normally smoke or...
Honorable Member.
I don't know it.
Honorable Member, are you asking a supplementary question?
No, I want
Honorable Member.
I want the Honorable Minister to clarify this.
Are you asking a supplementary question?
No, I want the...
Then don't ask any question.
No, I'm trying to clarify.
Honorable, you are either going to ask a supplementary question or you sit down.
Okay, so supplementary question. Differentiate the meaning of TABA, because a layman on the street, I don't know what is TABA. I thought it's TABA that they normally smoke from the shops. Or tell us what is TABA.
Thank you very much. Honorable Member, TABA was also not known to me until I started seeing the problems caused by it. I think it's a combination of many things that is said to come from other countries, and sometimes it's made here locally. I think it has some stimulants. Probably the tobacco is there and other things that it acts as a stimulant that some I'm told some women use. It gives us a sensation of comfort. We are told, and then so some people get addicted to it. But because it's not sterile, it can cause infections. It can come with germs. In the process, it can irritate the mucosal lining and also cause scarification. A place that's supposed to be smooth becomes firm and stiff, and then difficult to expand when the need for expansion arises. So this is the problem, and we are told it is widely used in this country. Certain people have looked at it locally, and we are told even young people use it now. So we all need to advocate. I'll appeal when you go on track, you also help us in the advocacy. Thank you.
Thank you. Honorable Member for Woolly East.
Thank you very much, Honorable Speaker. Honorable Minister, there is this traditional primary health care givers in the provinces that are responsible or working with traditional birth attendants, and they are allocated to cluster of villages. The last time I checked, their main problem was they were talking about mobility. So I don't know whether you have actually any provision to ensure such people do have mobility, even though there are, ambulances, but those people, the role of those people should not die. It should continue because they are carrying a very important role there. Thank you.
I think that component is dealt with in our primary healthcare revitalization program. We want to revitalize primary healthcare. So Gambia has almost half of the villages in the Gambia are primary healthcare core villages. Now we want to make it 100% so that every village in this country has a primary healthcare structure. So that will help us revitalize that, and they'll be giving the required support. Thank you.
Member for Banjul Central.
Thank you, Honorable Speaker. Honorable Minister, in relation to, I would like to ask if there are any better other health centers or hospitals.
Thank you. Thank you for that acknowledgement. They're doing very well. And coincidentally, just yesterday, we were discussing the issue of expanding their strategies to other facilities. So the best practices. Yeah, so part of it is early antenatal care and dedicated staff, because whatever you do, the staff have to be dedicated. That is very important. And strengthening, they have quite a number of skilled midwives, and also they have quite a few doctors, but with skilled midwives and the doctors, but also the education bit of the patient, the sensitization. Because when they talk to them, they teach them, they train them. Everybody wants to give birth to a healthy baby, the mother and baby healthy. So at the induction, when they come, they give them the health education. So we intend to expand that as you suggested. Thank you.
Honorable Member for Tumanna.
Thank you very much, Honorable Speakers, for the village health workers and CBCs. The model for giving training to your personalities, whether this is going to cover the village health workers. Thank you.
Thank you. So in the primary health care revitalization, we want to go back to the villages and ensure each village has a structure. And one of the strategies we want to have now is we want to have, inshallah, health champions. So when we have mother and infant health champion, each village will have one. We will contact the village to identify someone. Malaria champion, so each village will have that. So you see, when you empower them, you give them that responsibility, they will take it seriously and they will support government in achieving our goals. So that is what we are going to do soon. Yeah.
Thank you very much, honorable members. Let me, on your behalf, thank the Honorable Minister of Health for ably answering your oral questions and even gone beyond. And to all of you who have asked questions, both principal and supplementary. Honorable member, I think we can release the Honorable Minister. Honorable members, it is 13:55 almost. Options we can do is to break off before we start with the next minister, to break off for lunch and the prayers, or if you choose to, and you're still strong, we can continue. We go and pray. Honorable members, my problem actually is we will agree on a time and then we'll come 1 hour above that time. Yesterday we agreed at 2:30, we were here by 3:30. Can we all try, this time we are going to make it an hour. Can we all try, it's almost 2 o'clock, so that by 3 o'clock we are all in the chambers and begin our work. Is that okay? Okay, honorable members, then the House stands suspended until 1500 hours today.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonics Money Transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.